The overall vision for WVU was really to build a collaborative heart and vascular institute that tore down the silos that we're all used to, the standard silos of cardiology or vascular surgery or cardiac surgery, but to build a tower which would cohabitate all these subspecialists in one space to work together collaboratively focused on the patient. Our goals were really to have the most functional room no matter what case needed to go in there. So the hybrid rooms that we built with Philips technology, they have the FlexMove technology with integrated Mackay beds. This allows us to utilize those rooms for anything, whether it be a standard open operation, a hybrid procedure, an advanced endovascular procedure, or even a cardiac surgical procedure.
And with Philips and how easy it is to use, helps us, immensely, obviously, because we do 7 or 8, 9 angiograms in a day. Some places, that's a 12, 14-hour day, and then with our case, it's 8, 9.
The Philips technology offered something that was above and beyond what any other company had at the time, and I think still today. The technology involves the bedside controlling. The bedside controls are totally integrated, meaning that at the table side, I as a physician can do any kind of image processing or any control of the imaging equipment by myself. This speeds up my activity as well. I'm not waiting for someone to bring up a particular image or bring up a table position. I can do it all myself, and who knows better what I want to see than myself. So I don't have to waste time expressing to a tech, this is what I want to see, this is what I'm looking for. I can do it all myself. Meanwhile, the tech can be in the back in the control room. They can be working in parallel, such as working on the next patient, bringing up the next procedure card, or they can be reprocessing images for final storage on the current patient. They can do almost anything they want back there. Very rarely do I need to call a tech into the room to assist me with image acquisition or image processing.
It helps with the workflow in the sense that by optimizing that, it minimizes some of the time that it takes to get lines in, as well as the endotracheal tube from our standpoint. The Azurian FlexMove has allowed us to move the C-arm from the left side of the bed to the right side of the bed. Sometimes we'll come in at angles that'll give flexibility to not only us at the head of the bed, but also if the surgeons where they're working, as well as occasionally when we're doing TAVRs and things like that, we have cardiologists that are up there sharing the head of the bed space. So we'll come in at an angle to give a good view and minimize the amount of radiation, but allows everybody to kind of be in a position that's optimal for good patient care.
So our staff as well, just like the institution, is commingling cardiologists, vascular surgeons, and cardiac surgeons together. The staff are commingled. So our RTs work in the cath labs as well as in the hybrid rooms, and there's actually different equipment in those rooms. They have no problem whatsoever transitioning between rooms, and in fact prefer the Azurian room because it is so intuitive and so easy to get the machine to do what you want to do, what you want to accomplish. They also feel that the imaging is significantly superior. So the staff actually prefers the hybrid rooms. The FlexMove technology has really improved our efficiency in turning the room over. It also has improved the utilization of the room. We have larger rooms, around 1,100 square feet, but we can move the C-arm at the end of a case far out of the way, which creates an ease of access for the cleaning and turnover. But not only that, if the next case happens to be a truly open case that doesn't require fluoroscopic imaging, the C-arm's out of the way. It's removed. It's not in anesthesia's way, it's not in the surgeon's way. It doesn't affect the utilization of the room or the utility of the room. So from an efficiency perspective, it makes it much easier to clean in the room. From a utilization perspective, the room is never absent, meaning that there's always a case that can go in there because it can be used for any type of procedure. As not the most computer-savvy individual in the world, I worried about it initially. However, utilizing the tablet form controls, they're extremely intuitive. They are probably simpler to use than an iPad, and it's in an iPad form. So that access that I talk about, being able to do all the functionality to tableside, it literally takes a couple hours to learn all this, and then it becomes totally intuitive. From a surgical perspective, I hired 2 new surgeons, neither of which had utilized Philips technology in their training. They were able to adapt to Philips technology and move right in to be able to control the table itself and all the image processing. And it didn't take them more than a week to become very, very familiar with the functionalities and comfortable utilizing the table. From a staff turnover, meaning techs, radiology technologists, we have had turnover, and the new staff has found it very, very easy to utilize the equipment. We have a couple expert technologists who had taken some time to delve into the equipment with them. It didn't take them long at all to pick it up.
One of the benefits of us, and it's changed the way we do things, is the Vessel Navigator. We never had that to be able to do that prior to this. So now we know we have a AAA coming up in a week, or a fenestrated, with the, doing a 4 vessel. We can line that CT scan up with it, do all of these measurements and all of our stuff prior to the case even starting.
Vessel Navigator and the ability to fuse CT scan imaging and MR imaging with our fluoroscopy to help us reduce dose and help us reduce contrast utilization is critical to some of these more advanced cases. And with Azurion, we're very confident. We're using these technologies now. We're very confident they'll grow with us over the next decade. The Azurion has allowed us to expand our capabilities from a procedural perspective. Prior to us having the Azurions on site, we had started a fenestrated aneurysm program here, utilizing the Cook Z-Fen device, and it was labor intensive to do those advanced aortic repairs, as well as radiation dose intensive. Philips in the Azurion system allows us to use fusion of images. Our CT scans fuse and are co-located with our 2D fluoroscopy, and it allows us to cut down on time of these procedures, radiation dose to both the patient as well as the surgeon, and as well contrast utilization. So it's really made the way we think about complex aneurysms and the way we treat these aneurysms, it's really evolved our approach. And we're starting to use that same approach when it comes to venous therapies with fusion of MRVs for venous outflow obstruction, fusion of MRV with the fluoroscopic image, and utilizing IVUS all at the same time to help judge whether or not we truly alleviated venous outflow obstruction or what the degree of that obstruction is. We wanted equipment that would grow with us as technology grows and as understanding of disease processes grows, and that's what's happened just in the last 18 months related to venous disease and venous outflow obstruction. And we hope it continues for the next decade.